Knock, knock. You're supposed to say who's there? All right, fine. I will. Who's there? Anino. Anino who, you ask? Anino virus. Get it? Like, adenino virus. The joke was much more funnier inside my head when I said it. Anyways, on a much more serious note, over the past 2 weeks, we have been officially working with Dr. Aisha Garba and health professionals to learn about acute respiratory infections in Nigeria. Our work has conducted of serious research, developing public health campaigns, diagnosing patients, and prevention toolkits for residents in Bauchi State. We are confident to know that the extensive change in mitigating the spread of adenovirus is in Bauchi State and will positively impact many people who live there. What you all are about to witness is the rest of my lovely team members telling you guys about the settings all the way down to the nitty-gritty of our sources from the public health campaign. But first, I'd like to introduce myself and my awesome team members.
Hi everyone, my name is Ria.
I'm Ella.
Hi everyone, my name is Micaela.
And I'm Shritanvi. And now I will be talking to you about adenoviruses. Adenoviruses are a broad group of acute respiratory infections consisting of the common cold, viral croup, pneumonia, bronchitis, and many more. Adenoviruses are difficult to stay away from because they are extremely robust and can remain resistant to common disinfectants for long periods of time. When people contract these viruses, they experience serious symptoms like stuffy nose and cough that can cause the rapid spread of these viruses. They may also experience discomforting symptoms, such as sore throat, swollen glands, fever, chills, trouble breathing, high-pitched sound when breathing, vomiting, headache, and stomach cramps. Most at-risk populations for adenoviruses include children under the age of 6, immunocompromised people, and those with respiratory or cardiac diseases. In particular, one severe consequence of these viruses is that they can result in long-term lung damage. The fatality rate of the viruses is 16.7%. So in terms of setting, our campaign is targeted to help Bauchi State, which is located in the northeastern region of Nigeria. As shown in the graph, respiratory infections are one of the leading causes of death in Nigeria. Since Bauchi consists of many vulnerable populations suffering from already underlying health concerns, such as malaria, meningitis, and tuberculosis, it is likely that something that seems just like the everyday cold to us is a much bigger problem for people in Bauchi, which is why we have created this campaign to help Bauchi State. Although there are not any current initiatives that combat all adenoviruses as a whole, there are many effective ones that are trying to fight specific illnesses caused by adenoviruses, like pneumonia. About 4.2 million children in developing countries are reportedly living with severe pneumonia and are at a higher risk of dying if not properly treated. However, the Scaling Pneumonia Response Innovations Project, also known as SPRINT, is taking a systematic approach by ensuring that all low and middle income countries have the resources to treat the disease. SPRINT is using a country-level triaging tool to determine both the availability and effectiveness of pneumonia treatments, such as amoxicillin tablets and oxygen therapy, for those countries and populations most in need. Another initiative that is currently happening is the Stop Pneumonia Initiative, along with the Every Breath Counts Coalition, who are hoping to decrease the number of children dying in developing countries from pneumonia by the year 2030 through educating the public and urging national governments to recognize pneumonia's presence in their countries. These campaigns helped us gain the inspiration we needed to design our own solutions because we were able to learn so much about working at the international level to change public perception around this illness. Now let's hear from Ria about some social determinants in Bauchi State.
Thank you, Tanvi. And while the current initiatives that Tanvi mentioned are successful, they still must work to encompass and address the three main social determinants of health that affect the spread of adenoviruses. We are targeting each of the populations affected by these determinants when proposing our own solutions, and will briefly cover them now. The first social determinant of prevention is income and social status of citizens. Impoverished and low-income individuals are at a larger disadvantage because they are more susceptible for contracting adenoviruses. Due to their hardships in affording healthcare insurance, hygienic supplies, and other materials needed to maintain a sanitary household, their health is at an increased risk. Secondly, the physical environment of individuals also affects their ability to prevent the spread of adenoviruses, because those who live in close quarters or in poorly managed areas have a higher chance of coming in contact with infected surfaces or people. Finally, one's education plays a major role in their healthcare because those who lack access to regular education may be unable to find resources and information on how to protect themselves from contracting dangerous diseases like adenoviruses. In addition to social determinants of health, it is also imperative that certain considerations be accounted for when implementing solutions as well. In regard to Bauchi State specifically, it's important to note their infrastructural limitations. Our research has revealed that a staggering 71.7% of toilets in Bauchi State lack hand washing facilities with soap. Evidently, this issue must be better addressed to ensure that residents have adequate access to sanitary materials. Additionally, we found that 3.9 million residents lack access to water, sanitation, and hygiene or wash services. We have specifically considered this when proposing our solution so that this large majority of people are given access to the necessary facilities needed for leading a hygienic lifestyle. Finally, another report disclosed that 84.7% of Bauchi State citizens don't treat their drinking water. And according to the same report, the current outbreaks of cholera in the state are largely attributed to contaminated water and liquid waste, which is further sentiment to the fact that their infrastructure relating to sanitation and hygiene must be improved upon. Another major consideration to take into account is finance. Since the Nigerian government allocates less than 5% of their budget to healthcare, most Nigerians cannot afford even the most basic of procedures or materials needed to live a healthy life. In fact, most of the population lives on merely $1 per day. Clearly, they need more economic support to finance their healthcare expenditures and lead healthier lives. To address these concerns, we have proposed three main solutions: a long-term, short-term, and educational solution. As for the long-term solution, our proposal is to ensure that Bauchi State be granted participation in the SURWASH program, which stands for Nigeria Sustainable Urban and Rural Water Supply, Sanitation, and Hygiene Program. The SURWASH program is funded by the International Development Association, or the IDA, which is providing $700 million in credit to provide 6 million people with drinking water services and 1.4 million access to sanitation services. This program will support the NAP, or the Nigeria National Action Plan, which is a 13-year strategy prioritizing actions to have Nigeria free of open defecation by 2025. Furthermore, the program is open to all Nigerian states, and it's clear that the SURWASH program facilitators will endorse Bauchi State because the region consists of all the vulnerable populations who will benefit from the policy reforms. Since this is in the best interest for Bauchi State and its government, we have no doubt that they will be willing to cooperate with this program due to their previous efforts in helping their citizens accomplish improved healthcare and hygiene. To ensure the state's participation, we have drafted a letter in the toolkit to send to the program facilitators. Now that you've heard about the long-term solution, let's hear about the short-term and educational solutions from Michaela.
Thank you, Ria. The next solution is a short-term solution designed to quickly reach residents of Bauchi State and inform them of how they can prevent the spread of adenoviruses. Both new and returning patients, as well as members of the general public, can visit the Nagari Medical Clinic and Maternity Ward to pick up an infographic card to learn what they can do to mitigate the spread of adenoviruses. We've ensured that the three key preventative measures listed on the cards are worded in simple terms so that they are easy to understand and accessible for everyone. We ultimately hope that these cards will be distributed to local community members or spread via word of mouth to make the public more aware of the dangers of these viruses. Our final solution is a campaign initiative targeted at educating school teachers about how they can incorporate adenovirus prevention measures into the classroom. We believe that education is one of the most transformative elements in an individual's life, as it transcends cultural and linguistic barriers and allows us to adopt a high level of respect for our teachers. Therefore, we believe that teachers can effectively communicate the presence of acute respiratory infections to their students. To accomplish this, we have incorporated a few of the most demanding determinants of public health into our curriculum to meet the needs of the population we are serving. So far, we have designed 2 public health lessons for teachers to add to the regular curriculum. As you can see in the presentation, one of the lessons is an activity that allows students and teachers to make their own masks. We tailor these lessons to be child-friendly and easy for teachers to give students to take home or to display in the classroom. We believe that both teachers and children will find this curriculum extremely beneficial because it is a great way to appeal to the youngest members of our target population and teach them about proper sanitation at a young age. After finalizing our solutions, we created a timeline to plan our implementation. Our plan begins with contacting the Sir Wash program facilitators to confirm Bauchi State's participation in the initiative. We then plan on making sure our designed infographic cards are printed and passed along to the Nagari Medical Clinic. After this, we will send out letters to various schools in Bauchi State, introducing them to the infographics and posters we designed. Lastly, we plan on sending out surveys to all participating groups and members of our initiatives at the beginning of our work to determine what they already know about prevention. With this information, we will continue to send out incremental surveys every few weeks or months to regularly track progress among the government officials involved with the program enforcements, doctors at the Nagari Clinic, and the students and teachers of schools to determine the effectiveness of our efforts. Now I will be passing over the spotlight to Ella, who will be wrapping up her presentation and providing us with some final thoughts.
We are so grateful to Leadership Initiatives for funding our solutions. Leadership Initiatives is providing us with a range of $40 to $50 to allow our solutions to become reality in Bauchi State. To see our spending clearly, I have provided a table listing the purchases for the long-term, short-term, and educational solutions in both US dollars and Nigerian naira. For the long-term solution, no expenses are needed from our end. To allow us to print the infographic cards, we request $20. And finally, for the educational solution, to create and supply the educational workshop, we ask for $30, which brings our final cost for our ARI solutions to $50. Adenoviruses are highly contagious, but are easily avoidable if safety precautions are taken, like improving personal hygiene. It is so important for these communities in Bauchi State to have clean water so they are able to sanitize their hands. All communities deserve a safe and clean environment with people who know how to protect themselves with readily available resources at hand. Our goal is to provide these critical resources and teach prevention protocols for the public living in Bauchi State. Here are the sources we use throughout our research. And here's our contact information. If you have any follow-up questions, feel free to reach out to us. We look forward to implementing these plans and preventing lives from being lost, and hopefully providing ease to Bauchi Nigerian citizens. Thank you so much for your time.
Fantastic job, everybody. You can stop sharing your screen. I'm going to move over Mr. Jim Scott, and he's going to go first, and then I will go second with our feedback for you. Jim, do you mind just telling them what you thought of their presentation?
I was thoroughly impressed with the quality of the work you did. I want to commend you. I was really impressed with the ability to give hard statistics and the impact that it had. That was very well done. And I really liked the 3-solution approach. It wasn't a one-shot deal, but it was that immediate and then that long-term goal. And I think that's so important. Many times projects say, here's the solution, and it walks away. Here's a case where you're saying, let's continue this. Let's make sure it goes on beyond the immediate time. So congratulations on your great work.
Yeah, I just want to echo what Jim said. You guys had a cohesive presentation, and there was never a time where you guys weren't transitioning to the next person, telling a story. So as a judge, when we're looking at grants and we're looking to help other people, we want to make sure we believe not only is the project smart and viable, but can the students work together? Can they bring this to fruition? And everything you guys did showed how well you guys gelled together and how passionate you were about the subject matter. And each one led into the next. It wasn't just that you guys got along, it's you guys got along to the extent that you figured out which part you guys cared about individually and then spelled out each of those steps. So it's almost like you were telling a story. And that's literally exactly what we looked for in grant presentations. and you guys hit everything on the nose each time. I even like the colors of your team. And when you guys took the time to make sure, like, again, every aspect, was well thought out and designed, I could see the foresight and the dedication to the project. I can't wait to see this funded. I'd say this every time, but hopefully one of you is doing the international internship program so you can actually see this project to fruition. So guys, round of applause for you. Thank you so much for doing this. Super proud to work with each and every one of you.